So as a healthcare provider, we work with rural Indian populations. Why rural India? If you look at the distribution of population in our country, 70% of the population is rural and 70% of the medical infrastructure is urban. This creates a great urban-rural disparity for provision of healthcare. As a healthcare provider, what we are really trying to do is to say that what does it take to organize the healthcare market for these rural populations. Step one being organizing the primary healthcare delivery sector. You would see as and when you react with other people in our organization that we have a very systematic way of dealing with a patient. When I say a patient, it could be a community individual wherein we go out into the community and risk profile individuals, capturing basic demographic information to basic risk profile, which is non-invasive parameters for a person. And then when the person comes into our clinic with an ID card, which is a barcoded number which identifies that person into a health management information system, through the health extension worker, which is the first touch point of that individual, there is a very systematic way of dealing with the individual, preparing that patient for the physician with basic parameters like height, weight, blood pressure. Once this report is printed, the health extension worker then escorts the patient to the physician. The physician then follows the SOAP methodology, which stands for Subjective Objective Assessment Plan, which is the standardized way of how the patients are dealt with in the American healthcare system. This is what we brought to our context and checks a patient out through the standard protocols that we have in our system. We have a very ambitious mission set for ourselves, wherein we want to create disease-free villages for rural India.